Good evening, doctors. Welcome again. Today we are going to discuss about USMLE MCQs. Step 1. Let's start discussion. A 38-year-old man who is recently immigrated to the US comes to the physician because of 1 month history of cough and 4.5 kilogram weight loss. Physical examination shows no abnormalities. A chest X-ray shows a right upper lobe infiltrate. One of three sputum sample is positive for acid-fast bacilli. Treatment with isoniazid, rifampicin, ethambutol, pyrazinamide is started. Which of the following should be added to the medication regimen to prevent neurologic toxicity in this patient? So guys, think which antibiotic causes which vitamin deficiency. Pause this video and try to answer. So the answer here is this is vitamin B6 pyridoxine. Isoniazid causes pyridoxine deficiency and neurological symptoms. So answer here is pyridoxine. Hope it's clear for you. Okay, ethambutol toxicity, optic eye toxicity. Rifampicin, orange color urine. Pyrazinamide, responsible for uric acid excess secretion. Okay, now a 76-year-old man with a history of prostatic hypertrophy, BPH, benign prostate hyperplasia, we can say, has the recent onset of increased difficulty in urinating, means obstructive urinary symptoms. Some symptoms began shortly after he started taking nasal decongestant orally for cold symptoms. Which of the following types of receptor is most likely to be involved in this adverse effects? Alpha adrenergic. Think guys, pause this video. Which one is the best answer? You try to answer. So I will explain you. The single most best answer here is alpha 1 adrenergic. Why alpha 1 adrenergic? Because in prostatic hypertrophy we give drug which one? Alpha 1 adrenergic antagonist. Yes, agonists like alpha blockers. Alpha blockers we give. Adrenergic blockers like prazosin, tamsulosin, such drugs. Okay. Now, 15-year-old girl brought to the physician because of 3-week history of excessive thirst and voiding excessive amount of urine. She shows no signs of kidney damage and she is not taking any medication. Physical examination shows no abnormalities. She undergoes an 8-hour water deprivation test. She is also given 5 units of ADH vasopressin subcutaneously. Under both conditions, she continues to produce large amount of dilute urine. Her symptoms are most likely due to a relative lack of which of the following proteins from the apical membranes of collecting duct epithelial cell. So the answer here is, pause this video, think which is the best answer. So guys, I will explain you. The best answer here is aquaporins. Why V2 receptors? In this is a case of nephrogenic diabetes insipidus, central diabetes insipidus we can say. In case of central diabetes insipidus, ADH vasopressin when we give, then improvements we see. But here no improvement, that means receptor problem. It is due to nephrogenic diabetes insipidus. So the treatment of nephrogenic diabetes insipidus is thiazides which acts on PCT. So aquaporins is the answer here, because here is a problem with receptor V2 receptors. Okay, in central diabetes insipidus what we see, there is reduced production of ADH due to hypothalamus, but in nephrogenic diabetes insipidus ADH is normal but receptors are not working properly. Okay, a newborn infant suffers from cyanotic heart disease caused by transposition of great arteries. In this situation, the aorta arises from which of the following structure? Pause this video, think properly transposition of great vessels? So best answer here is, I will explain you firstly the thing. See, this is right atrium, this is right ventricle. So pulmonary trunk or pulmonary artery arises normally. This is left atrium, this is left ventricle, and aorta arises from left ventricle. But in case of transposition of great vessels, aorta arises from I will explain you in this way. Aorta arises from here, right atrium, right ventricle aorta. So right ventricle is the answer here. Right ventricle aorta, and left ventricle arises pulmonary arteries or pulmonary trunk. Hope it's clear for you till here. Let's move on next MCQ. During a brain surgery during which the patient remained conscious, a part of DCML, dorsal column and medial lemniscal system was exposed and stimulated. Which of the following sensation might the patient most likely experience? So pause this video, think which one is the best answer. Now I will explain you. The best answer here is a feeling as this one, something were touching his index finger, feeling as something were touching his index finger. Okay. The dorsal column medial lemniscus system is the sensory pathway that transmits conscious proprioceptive information with fine gradations such as a fine touch on the index finger and cerebral cortex. The brain interprets any signals coming along the labeled lines. The nerves that carry messages from the sensory organ to the cortex as being information about a particular sense. Hence, activation of certain neurons in the somatic sensory system can cause a sensation as if it originated from mechanical pressure on the finger. So guys, I hope till here it's very much clear for you. If you have any queries, any question regarding Usmle step 1, you can ask me. And if you like this video, put like on it. And if you're new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.